Hello, everyone. We're going to take a few minutes in order for the participants to arrive. We will begin shortly. And here we go. Hello, everyone. Welcome to this webinar. This is an information session regarding the thematic called Orbit Health. So just a small introduction first. So to those who doesn't know me yet, my name is Jonathan Russell, so account manager at MEDTEQ Plus, and I am glad to be your host today for this webinar. So a little bit of the agenda. So we're going to start with the context, the objectives of the thematic call. We're going to look at the eligibility in terms of not only the program, the projects, but the company as well who are allowed to apply. All of the terms, the process in order to deposit, as well as the calendar. And we'll finish this with a Q&A. So to begin with, what does the International Space Station have in common with the Arctic Circle? It's cold, but also it's far. And whenever things are far, they're most likely isolated. It can become very challenging, not only geographically speaking, but when we're talking about healthcare, in terms of resources, it poses a lot of challenges to be isolated. There are limited resources in terms of material, clinicians, installations, name it. In the end, those situations, the space station or in the northern regions, there are a lot of common things that overlaps between those care gaps, and the solution can help in both types of community. There are more and more solutions and technologies for telemedicine or for medicine in autonomous situations. So this initiative, Orbit Health, with the financial support of the Canadian Space Agency, will allow to support project for those kind of solution. So the objective of this call is really to support mainly research and development for technologies that will bridge the care gaps in healthcare autonomy with a short commercialization potential. So you know about this call. Now, what really is eligible? What kind of projects are eligible? So first, the organization. This thematic call has been created for Canadian companies. Not only they need to be incorporated in Canada, but also the headquarter needs to be in Canada. They cannot be owned by more of 50% by an organism, and that is true for internationally. So like a multinational cannot be based outside of have their headquarter outside of Canada. So the company needs to be also a member of our consortium to benefit the guidance in the deposit process. Because we have a team of account manager that's going to help you with your project's proposal redaction, see the scope of your project and see if the expenses are all eligible and if it's going to fit the timeline of your company, of your roadmap, basically. So companies also they can't be public or municipal, whether it's municipal, provincial, or federal. They cannot be public research center. They cannot apply directly to the theoretical, but they can be included in the project as a service offer. And also, you need to be in good terms with both provincial and federal governments. So what kind of project is eligible? Well, first, it's a contest. So company cannot apply more than once to this call. So choose your project wisely in terms of expenses, in terms of objectives as well. They need to be R&D project, obviously, for healthcare technologies. So no marketing expenses, everything's going to be focused on R&D. You need to show that it addresses a clinical gap, that it offers an advantage against the direct or indirect competition, especially in fields that are applicable to space or isolated communities. Um, the solution also needs to be starting at TRL 4 to 7. The reason why is because we want to have a short adoption potential. So the commercialization needs to be pretty soon. So we need at least a TRL 4, which means like you need to at least have the prototype and to show that you'll be able to commercially, not to commercially, but to be able to do some benchmarking tests with your prototype, do the validation in the clinical field, anywhere between that. Also, I'd like to have that the solution cannot be commercialized yet since it's R&D. So the financing modalities. So how much money? This is a very good question. How much money and how I'm going to fund the project? So it's a non-refundable financial contribution. We're talking about a grant, and it's up to 300K per project. We privilege SMEs in this startups and SMEs in this program. So the grant covers up to the covers 75% of the SMEs up to 300K. When we're talking about SMEs, it's by the definition of the federal. So it's 499 employees and less, and everything else above that is considered a larger company. And we only cover 50% of the project's expenses. So since it is a contest, there is no public funding available for that. The expenses covered are mostly R&D, as I said, notably salaries. In terms of cash flow, the way it works is when you sign the agreement, after the evaluation, the projects are going to be selected. You're going to sign, the recipients are going to sign a funding agreement, and 50% of the grant is going to be sent to the companies by that date. And then for the rest of the 50%, it's going to be at the end of the project upon showing adequate proof of the expenses. So keep your receipts and have a payroll log for all of your salaries. As usual, funded project needs to be scoped. So specific milestone, objective, planned expenses, you will be reimbursed only by the expenses that are originally planned. So you cannot include other objectives along the way or expenses that were not necessarily planned from the beginning as you deposited the project. There is a possibility for the companies, as I said a bit earlier, to have some service offer, whether they're from some external consultants or academic/research centers with a contract. So you need to have a signed service offer when you deposit the project. So this is the way they're going to be included. So public entities directly cannot necessarily apply. So which means like a research center and a hospital cannot apply, but they can be included in the expenses and the project. And I will show you later a bit the details about that. Just a little disclaimer on the calendar. The eligible dates, as you can see here, it's April 1st to December 31st. So it's pretty soon. So if for the service offer, whether it's from a research center that you need, like, let's say access to data, it's gonna need to go through ethical approval and it takes a while. So maybe that's not the right program for you since the expenses are very capped. There's gonna be no extension. All of the expenses are gonna be between those two dates. So we all know that ethics approval is long. So maybe not use this contest for these kind of expenses, but we have other programs and other organizations as other programs that cover those projects. We have a team of account managers, and the account manager will be able to guide you toward if this contest is really the best one for you or not, depending on what are your objectives and what are your expenses, sorry. So this is a list of the eligible expenses. Don't worry, like they're all in the guide and you will have access to the PowerPoint. I'm not gonna go through all of them, but I'm gonna put your focus on somewhere. So it's primarily salaries and training. Be aware that for external services, like I talked about service offer. So for external services, with service offer, the limit is 30% of the overall budget, and that 30% is all service offer included. So if you have multiple consultants, the total of the external expenses are going to be 30% maximum. And there's also a limit in terms of equipment, whether it's for rental or acquisition. It's not necessarily a program to fund necessarily that, to buy equipment or to develop or to rent them. It's mostly to develop a highly trained staff. You can have some equipment, but the total budget allowed for that is 25% of the overall budget. Here's the second wave of the expenses, and as I said, don't worry about don't worry about it. If you have any doubts on the expenses, just talk to our account managers. If you don't have an account manager right now, you can write us at projet@medtec.ca, or you have a link to take to have a meeting with them directly to the guide or at the end of this presentation. And we'll be able to assign you an account manager, and they will be able to see which you if the expenses are eligible or not as you build your proposal. In terms of ineligible expenses, there are quite a few as well. As I said, it's mostly for R&D, so anything that's marketing, it's not to be included. Anything that's already commercialized, anything that's normal, like regular business fee, like in terms of like rent, electricity, or anything, it's not going to be included in this project directly. Staff can be covered, as I said, like engineers, clinical experts and everything, they can be included, but only in the proportion as they work on the project. If your engineer, let's say, work 50% of his time on the project, but 50% on another project, you're only able to bill 50% in your payroll log, because we want to avoid that this engineer is paid twice by another grant for his other activities and so on and so forth. So that's it. In terms of the process of the calendar, as I said, you will have guidance. Yes, it's a contest, but we still support you. The account manager team will support you through this to this proposal. We review everything together with you. If anything is eligible, if you need more, if you need help, we do not do the redaction for you, but we help you redact. Like we do some comments and feedback on you need to have a scientific reference in this or that. So the way it's been chosen this way is because we want to maximize the chances of success for the projects, to have the best project to present to our evaluation committee. So now where is the form? How do I apply? This is exactly why we decided not to post the proposal form, the template directly online. After your first meeting with the account manager, once your organization and your project has been like assessed, we will be able to send you the form and the budget sheet, and then you're going to be able to work with them on your proposal. I'm not going to go through all of the proposal, but I'm going to show you the evaluation criteria and the sections, and the account managers, as I said, they're going to go through the proposal with you and to put some key pointers. So the first section is going to be the description of the company, but also its participants. So how is your company relevant to the project, and how are all the participants relevant for this? So if you have one engineer, one dev, and one clinical expert, what are their implications in the project? What are going to be the deliverables they're going to be working on? The second section is mostly the description of the project overall, a little background with the state of the art. So you need to include references and statistics on the clinical gap, but as well as on the competition or other technologies, why your technology is the right solution to address this clinical gap, and how does it compete against other technologies on the market. You also need to justify the TRL, so the starting TRL. So yes, we have a prototype. We've already tested a few things in the lab. So we're at TRL 4, between 4 and 5. So we are eligible. You're going to need to justify that. The rest is the bulk of the proposal is going to be the work plan. So for the work plan, it's going to be like the objectives, clearly, like deliverables. The people that are in your participant list needs to be assigned. Like this person's going to be the lead of this deliverables, and this person's going to work on it, and so on and so forth, as well as the budget of all of those expenses. For the next section, it's going to be the expected benefits. So in terms of science, what are the scientific breakthrough that you bring to your company through your project? The next one is the direct benefits for the company. Let's say, oh, this project is going to help us to commercialize sooner because we're going to be able to have some data, and we're going to be able to have a funding round and everything. The social benefits for Canada, what's the positive impact on the healthcare system and the patient journey as example. And the rest of it is going to be for the economic benefits. These ones are more in terms of employees and training people. So how many employees directly you're going to generate or indirectly throughout not only the project, but in the near future. If you commercialize, we plan on having like to create like 30 more employees in the next 3 years or so on. One of the criteria is developing a critical mass of highly qualified personnel. Those people can be PhDs, masters, senior dev, people with not only academic background, but also work experience are going to be able to justify that. And the next section is the maturation plan. So in terms of IP, do you own the IP? Justify that you can commercially use the IP. Have you done any background check if other companies has something that competes with you or not? What is your commercialization plan in terms of in the next 2 years? What proportion of the market you're going to be able to address? What's your adoption strategy? You're going to start with Canada, you're going to go to the US, so on and so forth. And then there's the risk management, which is this time, if you know our usual proposal, this time it's been separated into multiple aspects. So the road to commercialization, what are the risks in terms of also the regulation in terms of regulation risk, but also the risk directly associated with the project. What is the risk that you have trouble hiring new people for your project, and how it's going to jeopardize the project if the project is 3 months late when the project is only 9 months and there's no extension possible. So you need to justify that and to have some mitigation risk upon that. And the last section is the most important because it's the one that's directly associated with the thematic call. So it's the criteria on it. So there's a few information that is in the other section, but this one is really a recap of that towards the thematic call. So how is your project really related to helping remote communities to telemedicine, to autonomous medicine and everything. This section is 8 out of 35, so do not neglect it. It's going to be a good wrap up, so make sure to put some attention into it with your account manager because it's going to be the major factor between choosing one project versus another. You have a description here. It's in the guide as well, but a little resume of the description of the criterias of the call. So developing a critical mass of highly trained and qualified individuals, support data collection and activities related to space, but also applicable on terrestrial market. So you may lose some point if your technology/solution is only applicable for astronaut, but it doesn't really help a lot of people on Earth. If your market on Earth is so small that it doesn't really worth commercializing, it's only for astronauts, you're going to lose a bit of points. So the evaluators are going to be well aware of that criteria. So it needs to apply to both. And it needs to show that the benefit for those terrestrial markets will come in the near future. So this is why we have the short adoption potential and the TRL, the starting TRL to be a bit later staged. In terms of calendar, so the first deposit is March 1st, 17 Eastern time. So it's pretty soon, actually. What does the first deposit mean is the date that we want to have a draft, at least a draft, the bullet points and the bulk of the content of your proposal and the budget that needs to be secured, not necessarily secured, but defined. You need to have at least that for March 1st. if your account manager does not have this document by then, your proposal we will not consider your application. It's not going to move to the next stage. So in between the first deposit and the final deposit, it's going to be the review period. So the final deposit is March 15th, 17 EST. So if you send a proposal later than that, the next morning, or your document is sent, but it's not necessarily signed, we will also not consider your application since it's a contest. We want to be a bit more strict upon that. But that being said, there's nothing against the fact that you can deposit, you have the first deposit or send the draft to your account manager earlier. Because we put some guidance into it, the earlier you can have a draft sent to them, the earlier we can send some feedback to you to be able to refine your proposal as much as possible. Because the 2 week delay is pretty short, considering there's going to be a lot of proposal that's going to come in our pipeline. So we also need the financial projection and the financial statement by that date. So the financial projection is going to be for the next 2 years or so. We have a template, so we're going to be able to send the template as well for that. The evaluation committee is April 11th. So the way it is so spaced is because we're going to have a lot of evaluators evaluating the proposal, and the evaluators are going to evaluate all of the proposal to be able to order them into like, this one is the best, this one is the second, the third. And since we have a finite envelope, the contest, we're going to select only the top few proposal until the budget is going to be capped for the envelope that we have. So we're going to select all the top ones this way. This is why we have a bit longer delay between the final deposit and the evaluation committee. Be sharp on the evaluation committee, because the evaluators have the right to ask questions and clarification to the company before approving a proposal. So this is a way to give the team a chance if something was not necessarily clear in the proposal, but the evaluators want to give a chance for the company to answer some question, and then they're going to choose yes or no, this proposal will be accepted or not. So try to be available during those dates. When the questions are sent, you only have 5 open days to answer them. And after that period, all of the questions and clarification are going to be compiled, and then we're going to reorder all the proposal to have the decision made. And the mailing of the decision letters is going to be May 17th. Sorry, some of them are in French. I just noticed that, so sorry about that. So that was the bulk of the content of this webinar. So I invite you to have some questions. I already see some of them, so I will start answering by the ones I have in the Q&A. So hi, so they have a remote monitoring platform. Unfortunately, cannot. Yes, this session is recorded. And in terms of SME's contribution, the SME contribution needs to be in cash, not necessarily in resources. So that's a very good question. So for an SME, the project total, if you want to cap the max budget, is 400K. The 400K needs to be in cash. So you need to prove that you can support the rest of the expenses. So it's not sending the cash elsewhere unless it's a service offer. So if you have like only the easiest scenario is only staff. So if you have four engineers, each paid 100K, you need to show that you can pay in cash the 4th engineer, because the grant is only cover the first 3 ones. Next question is, what is MEDTEQ plus expectations for the project, considering the total timeline is only 9 months? If the technology is at an earlier stage, what would be the focus to move on to the next year? That's too little difficult time frame. We are aware that it's a very little time frame. The goal of the call is not necessarily to have the projects commercialized at the end of the project, but at least that you are able to move in those stages. So yes, sorry. So you do not need to have compared to some other program, at the end of this program, you don't need to be commercialized, especially if you're TRL4, you just need to show that like in the next few years, you'll be able to commercialize, and this project is going to help you propel that, power that. Do I need to already have a collaboration with the CSA before I can apply? No, there is no collaboration needed with them. This project is only, we have the financial support from the Canadian Space Agency, but you do not need to have a partnership already with them as long as your project fits the thematic that the CSA targets. So there is no word count in length, but in the proposal, you have an idea, an estimate of how many pages should it be. Like it's like around 0.5 pages or around 2 pages and stuff. So everything is detailed in the proposal template. So what percent of expenses can be out of Canada? Usually the expenses out of Canada are, well, all of the internal companies, let's say it's a bigger company and you have staff outside of Canada, unfortunately that is not allowed. And we have like a soft rule that like, it's the same as the service offer. So 30% of the expenses can be outside of Canada. That's the big maximum, but there's also a lot of justification towards it. If it's only 10%, it's going to be way easier to justify than having 30% of all the expenses that are covered outside of Canada. Is the research institute tied up with 30% budget allocation mandatory for 30%? Can it be more than 30%? Yes, so if you have research institute, the cap is 30% of what we can cover. Everything else, if it's higher than that, the rest of it needs to be covered 100% by you. So basically, it's easier for you to just cap it at 30% and have the rest of the expenses outside of the project and pay like 100% of them. But the maximum of all of the service offer expenses, like research institute, the maximum total is 30% of that. Next question is, do we need to have the cash before the project starts and being selected, or we should have the money after selected before we're fully awarded the money? So for the financial statements and for the financial projections, you do not need to show that you already have the full amount of the proportion that you need to pay. So let's say it's 75% and it's 25%. So you do not need to have the 100K in your account as of the time of deposit, but it's going to be evaluated towards your financial projection, and any proof to say that, oh, you're in the middle of an investment round and stuff and you only have 50K right now, but you're going to have another amount. Everything is going to be taken into account in terms of risk management also. So all of the, there's going to be a two-stage evaluation. The project are going to go to the scientific committee at first, the evaluation committee at first, and then we're going to look at if you can support the project financially or not. And we're going to compare and we're going to pick the less risky ones. If you already have a project with RB and recruitment has just started, but if I already project with RB is C and recruitment has just started, but I need funding. Can you clarify that question, please? I'm gonna for the R&D and the recruitment. If you can clarify the question, please. If not, I'll address other questions and I'll be able to. Will the formation of a new company be applicable for this? To be able to apply, you already need to be incorporated in Canada, and the TRL level needs to be at least 4 to 7. So if you have a spin-off or whatever, you need to show that the spin-off is not controlled by 50% by your main company or by the lab or whatever. So it's if you have some tricky questions like this, you can always talk to our account manager after that, or you can leave your question project at medtech.ca, and we'll be able to answer you a bit more in detail. Can we add this competition to an existing larger project to support a sub-component of a larger project? Unfortunately, there's no co-funding opportunities available for this project. The goal is to have really smaller project and to be only funded by this as the usual cap for a project to be funded is usually 80% and sometimes 75%, depending on which government you are talking about. 75% already reaches the cap of the co-funding unless you have a larger company than 500 employees. So is salary in-kind eligible for the 25% contribution? Well, if you can show that it's not necessarily in-kind salaries in terms of like those people are going to work for free, the equivalent 25% of the project, and then they're going to be paid the other 75%. So you need to show that you are able to pay for those salaries yourself with your cash flow. So is European Space Agency funding usable for the 25% funding? No, you need to show that you can pay yourself with private money the rest of the project. It's part of like the risk mitigation and the part of like the company needs to be accountable for their own project. So it at least has some risk or stakes. How soon the commercial aspect to be considered in the pilot study will be held, but we will still need confirmatory studies, which will take 1 year. Will pilot research outcome be considered? Can ongoing research projects be considered where recruitment of patients has already begun, but project still needs funding? In this scenario, I would invite you to talk to one of our account manager later, but right now on top of my head, if the project is not yet funded and you already have or you can have the ethics approval of all the approbation by the time that you start the project in the expenses timeframe, then I would say yes, this project can be funded by this contest as long as it fits all of the other criteria, as I said, like between April 1st and December 31st. And if it's not already funded, even in a portion of from another source of funding. So I don't know if that answers your question. I have the other question. Can you show the slide again on the call objective criteria? Yes, I can. Just a minute. Yes, to have access to the application form, you need to contact our account manager team. So by klaje@medtech.ca or directly book with them via the link. One of the link is in the one of the slides, or it's available in the guide, so you can have you can have a meeting directly there. And after we scope your project, that we know that you're eligible for the project and the expenses are eligible, then we will send you the application form and we'll also do a walkthrough with it. So will pilot study outcomes be considered? Yes, it's going to be considered. It's in the work plan as well. So all of the objectives and all the outcomes are going to be considered in terms of the TRL, or it's going to be in the maturation plan as well. So in terms of like how soon you'll be able to commercialize by having those results or everything. So it's going to be part of those criteria. Sorry. So if you have other questions, don't hesitate. If one comes to your mind and the webinar is over, you can always, and this thematic criteria are in the guide as well. So you'll be able to have access to the slide deck, but it's also in the guide, so you can refer to it later. So I'm just gonna show briefly. We're gonna have an FAQ. So we had a webinar, we had a session in French, and there were some different questions. So we're gonna compile all of the questions, and we're gonna put the answer in the FAQ on the website eventually. So you'll be able to, we'll update regularly depending on the question that we receive too. So if you have a question later, then you can just write to project@medtech.ca and we're going to answer to you. And we're going to put that answer as well in the FAQ. It's going to be available online. I have another question. Could you please elaborate more on the objective of the call and the types of project you will consider? So really, the objective is to build autonomy for isolated communities, whether it's in space or in the rural scenarios, people that have doesn't really have access to all of the resources and the services in healthcare. Uh, all of that needs to be applicable to both scenarios. So yes, for space as well as rural communities. Um, the types of project we will consider is, well, it's a call for healthcare solutions. So anything that touches healthcare and especially that can if you want some example, I would say like a lot of telemedicine. If you have anything to have remote monitoring, if you have also kits that can be sent to clinics or in space to have some diagnostic kits too, without having the whole equipment that they have in hospitals and everything, that can also be considered. If you have another example is a 3D printing solution that can 3D print like medical equipment uh, directly on board like the space station or in other remote clinics where they don't have access to the whole like supply chain of more urban areas. So there are a lot of ideas slash other types of technologies that can apply to those. So we have a comment here. So as a provincial health authority that can assess 2 out of 5 innovation for product market fit, these innovation assessments take about 6 to 8 months. If the technology solution fits a need within our system, we could assist an SME with this stage question to understand where your product fits in the market. MEDTEQ Plus, if there are any project such as these, please let us know. Yes, we will. Thank you. Is the expected outcome of this a study, experiment, or prototype? It's mainly the development slash validation of the prototype. So you need to at least have the prototype, and we expect that you accelerate that prototype in its stage to go through commercialization. You don't need to commercialize at the end, but the goal is to accelerate the commercialization of a healthcare solution, starting with the prototype. For healthcare technologies and everything, it's really important to have studies anyways. We do not necessarily cover the expenses for the studies in the academic centers, only up to 30%, but there are other programs in parallel, like our regular impact program that can cover those expenses. So those, you can apply to those in parallel. So the Orbit Health thematic call will be able to cover your internal expenses, but you can also apply to a regular call impact to fund the research side of it. I note that it takes the 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 process is a bit longer there, but you can manage the roadmap for that. And this is why we try to guide the companies toward the roadmap so that we can choose and make the roadmap of, okay, at this stage, we propose you, we suggest you this program, and then by the time it's done, you have already submitted to this program, so you can go on and on with your development slash validation of your technology. So this is the last call for the questions. If I don't see any other questions, the rest of them can be, as I said, sent to the project@medtech.ca, and it'll be a pleasure to answer those questions. Lastly, yes, how do we get an account manager? Again, you can contact us at the address I just read, project@method.ca, and we'll assign you an account manager or talk to any of us on LinkedIn or on our emails, and we'll forward you to an account manager to have a meeting with you. So thank you and have a nice day.